Do not, but no, that's trouble signing on to YouTube today. Maybe it has some longer, but okay. So let's talk about something else now. Okay, live-ish. I want to talk about COVID-19. And I came across a curious tweet today from someone called Andrew Saba Kovacs, Dr. Andrew S.K., University of Alberta, MD, 2015, University of Calgary Radiology, 21, University of Toronto Nuclear Medicine, 23, fighting for a better world for our children while the virus is being controlled. Alberta is the only one to feature average age of death, which has no relevance to pandemic response and is an attempt to minimize its seriousness. Alberta, 821 current hospitalizations, 146 currently in ICU, 890 total deaths in a province of 4.4 million, 17,821 active cases, 8,427 active cases in the Edmonton zone, and 2 years average age at death. Now, I'm sure Dr. Andrew, a firm believer in science, and yet here he is telling us that data is superfluous. Nope, we don't want to know. It's not in our best interest to know that the average age. I suppose why people don't want to see this is because it's suggests, of course, that COVID-19 is not much of a threat to young people or even younger people. So it's a very high survival rate. As I've noted previously, the average longevity of people in long-term medical facilities or caring homes is about 5 months. The average age of people dying in Alberta is 82, and I suspect it's rather similar around the world. Then, again, this is a disease that afflicts, is particularly dangerous to old people and to others with comorbidity. I see, I was sent a clip of Bill Gates, who is the world's biggest expert on vaccines. I don't know how that happened, but he is being interviewed by, I believe, COVID-19 vaccine is safe, and Bill goes and as people pointed out, why can't he answer the question? Does he know something that he doesn't want revealed about this? I noticed on Twitter that people have been accusing me of being an anti-vaxxer, which I am not. I have had many, many vaccines in my life, but I've had a difficulty with the COVID-19 vaccine even before the first two, the Pfizer and Moderna, were released, because they have been rushed through in record time. And on one of last week's shows, I was talking about another drug that was rushed through in record time to treat AIDS that was called AZT. And this drug killed every person who took it. I'm not suggesting that this is the case with the COVID-19 vaccines, but my own view is let's wait a few months, maybe a year, see how many cases of Bell's palsy and other things that we get, anaphylactic shock and the like. So I have no intention of being a guinea pig for this vaccine. And there seems to be, an insistence that everyone must take this vaccine. And, my question is, if it is so very valuable, if its value is self-evident, why the push for everyone to get it? Particularly, again, if the average age of people dying is 82, I am an old man, but I am not yet over 80. Let's go to Toby Young at Lockdown Skeptics. The media is full of alarming reports of NHS hospitals being on the brink of Armageddon, such as the surge in coronavirus patients As we head into the new year, we are seeing a real rise in the pressure on NHS services, particularly across London and the South East. That from Saffron Cordery, the Deputy Chief Executive of NHS Providers, to The Guardian. A letter from NHS chiefs sent to the chief executives of all NHS trusts and foundation trusts on December 23rd contained this alarming paragraph. With COVID-19 patient numbers rising in almost all parts of the country and the new risk presented by the variant strain of the virus, you should continue to plan on the basis that we will remain in a level 4 incident for at least the rest of this financial year, and NHS trusts should continue to safely mobilize all of their available surge capacity over the coming weeks. This should include maximizing use of the independent sector, providing mutual aid, and making use of specialist hospitals and hubs to protect urgent cancer and elective activity, and planning for use of funded additional facilities, such as the Nightingale hospitals, Seacole services, and other community capacity. Timely and safe discharge should be prioritized, including making full use of hospices. Support for staff over this period will need to remain at the heart of our response, particularly as flexible redeployment may again be required. And the Independent reports that the London Ambulance Service has issued a warning saying it can no longer guarantee an ambulance will turn up if women giving birth at home require emergency care. Sounds like a major crisis, right? Better move the rest of England into Tier 4, making mask wearing mandatory in all settings and close schools until Easter. Or is it? If you look at ICU occupancy in NHS hospitals across England on December 20th, it was lower than the December average in 2020. And it's worth remembering that the 2019 to 20 flu season was unusually mild. Admittedly, the total number of ICU beds occupied in London on December the 20th was quite a bit higher than the average for December 2019. And according to the ZOE app, daily symptomatic cases in London are falling. We have had an outburst again of the dancing nurses videos. Months ago, we were introduced to the dancing nurses and their choreography, and now they're back in a big way. That if nurses have time, plan dance routines, and then to carry them out for filming purposes to be uploaded onto the internet, then these nurses are perhaps not being run off their feet. Toby Young continues, I'm not suggesting that NHS hospitals aren't under pressure, nor even that they aren't under more pressure than the lack of ICU beds, and it doesn't appear to be a surging number of patients admitted to ICU beds with COVID-19. After all, if those numbers were surging on top of the usual December admissions for respiratory diseases, you'd expect the total number of ICU beds occupied to be much higher this year than last, and as you can see from the Spectator data, the totals are lower in 4 of England's 7 NHS regions. The reason for the crisis, if indeed there is a crisis, must lie elsewhere. My money's on a combination of higher than average staff absences and poor management. Disappointing, considering the NHS has had overseas. According to the country's leading psychiatrist, Toby Young writes, the ongoing restrictions pose the greatest threat to mental health since the Second World War. Dr. Adrian James, a president of the Royal College of Psychiatrists, said a combination of the disease, its social consequences, and the economic fallout were having a profound effect on mental health that would continue long after the epidemic is reined in. As many as 10 million people, including 1.5 million children, are thought to need new or additional mental health support as a direct result of the crisis. This is going to have a profound effect on mental health, Dr. James says. It is probably the biggest hit to mental health since the Second World War. It doesn't stop when the virus is under control and there are a few people in hospital. You've got to fund the long-term consequences. Demand for mental health services dropped at the start of the pandemic as people stayed away from GP surgeries and hospitals or thought treatment was unavailable. The dip was followed by a surge in people seeking help that shows no sign of abating. Data from NHS Digital reveals that the number of people in contact with mental health services has never been higher, and some hospital trusts report that their mental health wards are at capacity. The whole system is clearly under pressure, James said. Modeling by the Center for Mental Health forecasts that as many as 10 million people will need new or additional mental health support as a direct result of the coronavirus epidemic. About 1.3 million who have not had mental health problems before are expected to need treatment for moderate to severe anxiety and 1.8 million treatment for moderate to severe depression, it found. The overall figure includes 1.5 million children at risk of anxiety and depression brought about or aggravated by social family members. The numbers may rise as the full impact becomes clear on Black, Asian, and minority ethnic communities, care homes, and people with disabilities. Well, I suppose if you tell that every other person on Earth represents a dire threat to their lives, then a lot of people are going to go crazy because of this, as well as telling people that, oh, normal is over. There's never going to be a normal again. Oh, but we have the vaccines now. Does that mean that we can stop wearing masks and social distancing? No, 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 no. It doesn't mean that at all. When will it end? Who knows? Who knows? Toby Young writes, a reader has sent us a good piece setting out 10 reasons to be opposed to lockdowns. Here are the first 3. The research. Well, those who oppose lockdowns have rigorously sought to justify their position with research and can reference tens of studies to the lack of efficacy of lockdowns or stringent measures under different names. The government has been capable only of publishing one graph in their cost-benefit analysis of the tiers, which appeared to show a correlation between Tier 3 measures and a reduction in cases, since discredited. The use of data. While those who oppose lockdowns have analyzed all data in as close to real time as possible, the data used to justify lockdowns have been cherry-picked and often predictive, while being based on spurious assumptions that have repeatedly been proved inaccurate. The source and balance of information. While those who oppose lockdowns possess no bias in obtaining their information, the government is informed on the risks by a number of committees, such as SAGE, NERVTAG, whose sole responsibility is to consider the virus and present the risks of that virus. And then there's my favorite, number 9, censorship and debate. While those who oppose lockdowns are constantly appealing for open debate and free speech, the government avoids open debate, seeking instead to censor dissenting voices. Further, as there is a push to censor any misinformation, one can quite easily conclude that the massive information available and uncensored from dissenting voices must therefore be much closer to irrefutable, having had to pass a much higher standard in order simply to be available. A report by the BBC's disinformation reporter raises the alarm about the dangers of fake news. According to Mariana Spring, the flurry of online falsehoods about coronavirus are destroying relationships and endangering lives. But what sort of deadly misinformation is the reporter talking about? Scroll down and you find this paragraph. We cataloged mass poisonings and overdoses of hydroxychloroquine, a drug that world leaders like Donald Trump and Jair Bolsonaro falsely claimed cures or prevents COVID-19. Hang on a second. The claim that HCQ cures or prevents COVID-19 is false? I'm afraid that doesn't pass the fact-checking test, Ms. Spring. Over 200 studies have shown that HCQ is an effective treatment for COVID. Trump and Bolsonaro may have exaggerated the preventative and curative properties of HCQ, but that doesn't mean it's completely ineffective, and anyone taking it is likely to poison themselves. On the contrary, it's almost certainly no more dangerous than any of the COVID vaccines. Okay, so the chat is back. Anrun says, all good people love that, like ABBA. Yes, indeed. Anrun says, nothing worse has happened in 2020 than the dancing nurses videos. I'm almost serious about that. Jim Smith says, as the years roll by, we get closer and closer to all good people coming out of the closet and expressing their love for ABBA. Chogokin 666 does not like ABBA. Jim Smith says, about a dozen years ago, the late Lawrence Auster dubbed England the Dead Isle. Well, yeah. Again, I just, things have become so strange in this year that, of course, one begins to suspect that this couldn't be happening. Oh, we're going to have lockdowns and then open up and lockdowns and open up, and what, this is going to go on forever? David Goodhart of the Telegraph struck me most forcefully that day a grim milestone was reached with 100 health and social care workers reported to have died from COVID-19, and I was witnessing a national panic. I realized then that lacking explanation and context. Was the 100 plus NHS staff deaths from COVID a lot or a little? There are 600,000 patient-facing staff in the NHS, so a few probably die from infections they catch from patients every month in normal times. Was 100 deaths since the start of the crisis about a month earlier twice the normal rate, or 50 times? How did it compare to other countries? Not a word. In Britain, we are supposed to be good at media, and no doubt in some niches we still are. But at the start of the crisis, our main channels of electronic communication became showcases for our contemporary vices: emotionalism, virtue signaling, and a querulously adolescent attitude to authority. At the same time, I was keeping an eye on the main TV bulletins in Germany. They were having exactly the same debates as us over inadequate PPE supplies and the disease ravaging old people's homes. The news seemed to be delivered with more rigor and authority, and without the British reflex of blaming the government for everything that was going wrong. According to a poll in yesterday's Sunday Express, millions of Britons want the tiers to be scrapped. People do not want to wait for the whole population to be vaccinated. The one poll survey revealed that 1 in 5 people want the tiers to be ended when MPs have the chance to vote on them at the end of January. 3 in 10 believe that restrictions should end when all the over 60s and people in vulnerable groups have had the chance to have suggested restrictions should remain for most of next year until the whole population has had the chance to have the vaccine. However, only 32% of the 1,013 people surveyed in the week before Christmas support this position, which some MPs have already branded extreme. Former Cabinet Minister Esther McVey, the founder of the powerful blue-collar conservatism movement of more than 120 Tory MPs, said that the poll showed the Prime Minister cannot keep forcing restrictions on an unwilling country. Alex Berenson mentioned that the statistics for the state, that perhaps in Massachusetts, they have actually heeded a few voices of sanity during this year of the opposite. For kids, the flu is way worse. Researchers compare every COVID hospitalization in France in March and April to every flu hospitalization from December 2018 to February 2019. They found 8,900 hospitalizations for flu versus 1,200 for COVID. What about serious cases? 116 kids needed intensive care for the flu, 36 for the row. And deaths, 16 flu, nearly all in the youngest kids, 9 row. Oh, Mad Max tweets, I'm normally against censorship, but Alex Berenson is a legitimately dangerous person who could do a lot of damage with his vaccine fear porn. Berenson BBC reports 5 life-threatening events, 79 emergency room visits, and 4 hospitalizations, which must be low since more have been publicly supported. Looks like the side effect data is available, and it's not good. More to come very soon. Again, Bill Gates was asked